When taking ribociclib and letrozole tablets, it's important to follow the instructions provided by your doctor or pharmacist. You should take ribociclib by mouth once daily in the morning for 21 days, then stop the medication for 7 days. Letrozole should also be taken by mouth once daily in the morning for 28 days. It's important to swallow the tablets whole and not crush, chew, or break them. If you vomit after taking a dose, do not take another dose on that day. Take your next dose at the regular time. The dosage is based on your medical condition, response to treatment, lab tests, and other medications you may be taking, so be sure to tell your doctor and pharmacist about all the products you use. It's important to use these medications regularly to get the most benefit from them. Try to take them at the same time each day to help you remember. Do not increase your dose or use these drugs more often or for longer than prescribed, as it will not improve your condition any faster and can increase your risk of serious side effects. It's also important to avoid eating grapefruit or drinking grapefruit juice while taking these medications unless your doctor or pharmacist says you may do so safely, as grapefruit can increase the chance of side effects with ribociclib. Additionally, since these drugs can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle these medications or breathe the dust from the tablets. Some common side effects of ribociclib and letrozole include tiredness, nausea, loss of appetite, vomiting, diarrhea, headache, constipation, back pain, hot flashes, unusual sweating, dizziness, or trouble sleeping. If you experience severe nausea and vomiting, your doctor may prescribe medication to help. You can also try eating small meals and avoiding eating before treatment to help lessen these effects. Temporary hair loss may occur, but it should grow back after treatment. You may also experience pain or sores in the mouth and throat. To alleviate this, brush your teeth gently, avoid mouthwash with alcohol, and rinse your mouth with cool water mixed with baking soda or salt. Eating soft, moist foods may also help. It's important to note that you may experience serious side effects from these medications, but your doctor has prescribed them because the benefit to you is greater than the risk. If you experience any serious side effects such as bone fractures, mental/mood changes, or signs of liver disease, contact your doctor immediately. In rare cases, letrozole may cause serious problems from blood clots. Seek medical help right away if you experience symptoms such as shortness of breath, chest pain, confusion, or sudden severe headaches. These medications may also lower your ability to fight infections, so be vigilant for signs of infection such as sore throat, fever, or swollen lymph nodes. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you experience any other effects. If you have any concerns about side effects, don't hesitate to reach out to your healthcare provider. Before starting ribociclib and letrozole, make sure to inform your doctor if you have any allergies, especially to ribociclib or letrozole, or if you have a history of high cholesterol, bone problems, heart problems, liver disease, or kidney disease. These medications may cause drowsiness or dizziness, so it's important to avoid driving or using machinery until you know how they affect you. Also, limit alcohol consumption and speak to your doctor if you use marijuana. Ribociclib can affect your heart rhythm, leading to a fast or irregular heartbeat. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that can also cause abnormal heart rhythms. Low levels of potassium or magnesium in the blood can also increase this risk, so talk to your doctor about using ribociclib safely. These medications can also increase your risk of infections, so it's important to avoid contact with anyone who has a contagious illness. Before receiving any immunizations or vaccinations, inform your healthcare professional that you are using ribociclib and letrozole. Older adults may be more sensitive to the side effects of these drugs, especially the risk of abnormal heart rhythms. It's crucial to use reliable forms of birth control while taking these medications, as they may harm an unborn baby. If you become pregnant while using ribociclib and letrozole, speak to your doctor immediately about the risks and benefits. These drugs should not be handled by pregnant women or women who may become pregnant, as they can be absorbed through the skin and lungs and may harm an unborn baby. Additionally, it is not recommended to breastfeed while using these medications and for at least 3 weeks after stopping treatment. Be sure to consult your doctor before breastfeeding. It is important to be aware of potential drug interactions with ribociclib and letrozole. These interactions can affect how these medications work and may increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with these drugs include estrogens, tamoxifen, and tibolone. Additionally, other medications can affect the removal of ribociclib from your body, which may impact how it works. Examples of these medications include rifamycins, St. John's wort, and drugs used to treat seizures. It's also important to note that ribociclib can affect the removal of other medications from your body, potentially impacting how they work. These medications include alprazolam, eplerenone, ergot alkaloids, estazolam, and many others. Additionally, many drugs besides ribociclib may affect the heart rhythm, such as amiodarone, chloroquine, and methadone. Always consult with your doctor or pharmacist about potential drug interactions and how to manage them. If you or someone else has taken too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the United States, you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can contact a provincial poison control center for assistance. It's important to not share these medications with others. Before starting these medications, it's crucial to undergo lab and/or medical tests such as EKG, liver function, complete blood count, bone density, cholesterol, and potassium and magnesium blood levels. It's also important to continue these tests while taking these medications. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget a dose, it's best to just skip it and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing ribociclib and letrozole, it's important to keep them in their original containers at room temperature, away from light and moisture. Make sure to store them in a place that's out of reach from children and pets, and never store them in the bathroom. When it comes to getting rid of any unused or expired medication, it's important to do so properly. Don't flush them down the toilet or pour them into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company on the best way to discard them. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.